Pushing for answers, a nonprofit wants to know how local and federal leaders are preparing state corrections facilities for the pandemic. Along with 34 affiliates from across the country, Oregon's ACLU filed a public records request today, claiming it'll show how state officials, quote, ignored the impacts of COVID-19 on the prison system ahead of its spread.
Fox 12's CAMILA ORTI has been pressing Oregon's Department of Corrections for information on testing.
We know the Oregon Health Authority expanded testing guidelines last week, indicating that people in a group living setting, like in prisons or jails, can be considered for testing even without showing any coronavirus symptoms. I asked the DOC if that has impacted how they're testing inmates, especially now that we can see those numbers, which are updated daily on the DOC's website. As of Wednesday afternoon, Corrections reports that 108 inmates have been tested out of the 14,500 total people in custody. That's less than 1%. Of those 108 tested, DOC says 18 inmates have tested positive. The communications coordinator told me DOC is expanding its testing efforts in general, but said, quote, the adjustment to OHA's testing recommendations has not impacted DOC and that the priority remains with symptomatic individuals. ACLU of Oregon Interim Legal Director Kelly Simon says that's a concern.
There are over 14,000 people in our prisons, many who are elderly and sick. They're all living in close quarters together, and 100 tests is woefully inadequate, in my opinion.
Simon is calling for widespread testing. She said some people in custody are even hesitating to report symptoms because it could lead to a segregation cell. DOC reports that 25 inmate tests are still pending, and so far 15 staff members have also tested positive for coronavirus. The facility with the most positive cases is Shutter Creek, with 15 total between staff and inmates. Reporting in Beaverton, CAMILA ORTI, Fox 12 Oregon.